Well, good morning, everybody. Jeff Slakey and Spencer Hughes on the Daybreak Show. I have via Zoom video conference the Community Outreach and Navigator Program Manager for the Choice Regional Health Network, Amber Shirk. Amber, how you doing?
I'm doing great. How are you?
I'm doing well. Thanks for coming on in the midst of a very fast-moving situation. We had planned to have you on to talk about some upcoming in-person opportunities for open enrollment, which is happening here soon. But of course, the governor made his proclamation this past weekend and things have dialed back, but the information is still applicable and people are still open to go to the Choice Regional Health Network website, which again is at crhn.org. There's great information there, but open enrollment and it's just kind of a weird year.
It is kind of a weird year, but I think that it has provided some really awesome opportunities as well. Because a lot of people are starting to pivot to virtual meetings and online meetings and telephone meetings. A lot of our community members are becoming more familiarized and more comfortable with using that digital source of media. And it allows for them to do appointments in a way where they're able, in the past, not everybody is able to come into the office. And so when they call to do a phone meeting, it's really difficult to go through different plans with somebody and say, hey, do you want this one or that one? And they can't look at it and engage with it. And 2020 has given us an opportunity to be able to do things like Zoom meetings and share a screen and reach people who previously maybe weren't able to leave their home. And now they are able to get that more in-person attention. So I like to see the silver linings of it all. It has been a weird year, but I think it has also opened a lot of opportunities. And while having to cancel these in-person events is a bummer, we still have those opportunities available. And now we just need to really make sure people know how to reach us by phone or over the internet, or how to get a Zoom appointment if that's something they're interested in.
So let's talk about what would have happened at these events and how we're going to transition them to hopefully an online model.
Perfect. So what was going to happen for Mason County with Mason Health, we were going to have a tent. It was like a 10 by 15 foot tent with walls and sneeze guards and masks and hand sanitizer and disinfectant and all of the ways to keep everybody safe, but still allow people to come in person and do their applications. That's no longer happening. And so instead, what we're going to do is encourage them to contact like Alex Schiffman at Mason Health. And can I give his phone number?
Yeah, please.
360-432-7790. Or Susanna Lopez. And Susanna Lopez also is bilingual and speaks Spanish. So if we have any community members out there that need assistance in Spanish, her number is 360-432-7766. So they'll be taking calls and doing applications over the phone. People can also reach out to me. My number is 360-819-7836. And I offer people an opportunity to do appointments by phone, or they can schedule an appointment and we can do it by Zoom. That seems to be a really popular choice. I also have a pretty nifty Calendly link that people can sign into, and it puts up a bunch of times and they are able to choose the time and platform that works best for them. I think that's how I made this appointment with you.
Yeah, it worked out just fine.
Curiosity.
No, it's exactly right. I went to the link and it said this time for this half hour. I said, yep, that works for me. That works for you. And so it set up just perfect. So if you and I were to do this, if we're having this conversation and I'm interested in the open enrollment, Washington Health Plan Finder, and we start talking about the deals, and you're like, well, bronze level is blah, blah, blah. Silver is, yada, yada. You're right that's kind of hard to comprehend over the phone. Are you able to then share your screen or show a breakdown of these?
Yes. And that's exactly what I do. It also helps because, going through the application, there are aspects of the application where there's like privacy policy rules and different disclosures. And it's very dense, long reading, but it's much easier to be able to just share the screen with somebody and say, do you agree to these and have you read them, and give them the opportunity to engage with them. But when it comes to plan choices, I have found that sharing the screen and being able to engage with the client is so helpful. I think it also helps to break down some barriers and gaps that a lot of times people are intimidated to use the health plan finder. The system was originally set up to be I apologize, the words are not coming to me, kind of like a self-help website. Like you should be able to go in there, log in, and do your own account. And a lot of people, they get in and they get confused, or they get a little overwhelmed or nervous. And so if they're able to go through the whole application with a screen share and see like how I'm entering the information and how I'm looking at like, what do they mean by that? Because, different questions sometimes are worded in a way that might be a little confusing. However, there's a little hyper question mark that you can hover over, and it'll kind of put the lay terms and put it into a format that's a little more easy to understand. So as a client going through an application, really, I'm looking at the application very similarly to the way they would see it if they logged into their own account. And we can go through the whole process together, which then makes them more comfortable in the future to access their account, make their own adjustments, or do their own application in the future. Not that I'm trying to, move myself out of a job, but
as you talk about this, I'm thinking of plenty of other governmental agencies that have had issues over the last few months that would probably be real beneficial to help folks on a step-by-step basis like that.
It is. And they can see what I'm typing in.
Yeah.
See me. They can see the questions before they come at them, right? So like they already have those answers ready, and it goes a little bit quicker. And some people I even give the option, like, do you want to drive or do you want me to drive? And they're like, what do you mean? I'm like, well, you could log into your account and you could share your screen with me. And then if you get stuck, I'm here. And otherwise, I'll just kind of be quiet in the background and let you process through. And some people really are excited about that because they want to do it, but they just don't want to get stuck and then have to be on hold or reach out to try and figure out how to get past the next question.
So what's the deal with open enrollment now? Have the dates and times of eligibilities changed because of the virus? Is it open now? Is it open? Is it going to continue to be open? Are folks able to utilize this now or?
Open enrollment is from November 1st to January 15th this year. Generally, it ends December 15th. If you apply for or if you do your open enrollment before December 15th, you'll have a start date of January 1st. If you do it after December 15th, you'll have a start date of February 1st. I believe it is extended due to COVID. However, one of the things that I've been finding is that because of 2020 and its uniqueness, there's been a lot of different special enrollment periods and not open enrollment, but just like open times. And so a lot of people who are on qualified health plans were already assisted earlier on in the year during times where things were opened up. And so they were able to make their changes or update their applications. And so while it's, steady right now during open enrollment, it's definitely not as busy and rushed as I've noticed it in past open enrollments, because people had an opportunity kind of earlier on. And a lot of the reasons that people are switching over or adjusting their accounts is because of something that was caused by COVID, which allowed them to do it like a special circumstance.
Yeah. Washington Health Plan Finder's website is wahealthplanfinder.org. The Choice Regional Health Network is online at crhn.org. And I'll put links to these in the show notes as well as we're going through this. And again, on the Zoom call right now, Amber Shirk, the Community Outreach and Navigator Program Manager for Choice Regional Health Network. And then, of course, the great folks at Mason General Hospital, Mason Health at masongeneral.com. Well, I would imagine, hopefully, maybe we'll see one of these down the road, but if not, it looks like you're navigating this very well online for folks, and it's important, super important for people to have this coverage if they haven't received it already. Amber, good to talk with you.
Yeah, thank you so much for your time. Can I give you my Calendly link as well?
How about I put that link in the show notes so people
Beautiful.
can direct click on it?
That would be amazing. Thank you.
I keep you on the call here a little longer just to enjoy the background.
Yeah, I'm at the beach, everyone.
Oh my gosh, that's how it is these days in 2020. Amber Shirk from the Choice Regional Health Network. Thanks for coming on.
Thank you.